Welcome to the 1815 Minority Health Extension Funding Opportunity Information Session. This webinar will provide a brief overview of those funding opportunities available from Marshall University to reduce health disparities in West Virginia by reducing the prevalence of diabetes and cardiovascular disease through chronic disease prevention and self-management programs. Marshall University, the Division of Family and Community Health, is made up of a chronic disease team, and we have an oral health team, as well as a school-based mental health team, as well as the Appalachian Diabetes Network. And the network is a joint effort between the Division of Diabetes Translation, Centers for Disease Control, Prevention, and the Appalachian Regional Commission. We've had 20 plus years of building the infrastructure and capacity building for diabetes and health coalitions throughout the Appalachian region. The goal is basically to reduce the prevalence of diabetes and improve overall health outcomes. To date, we have about 64, maybe 65 health coalitions throughout the Appalachian region, covering 8 states. And the goal of this project is to reduce the impact of diabetes in the poorest of poor counties across that Appalachian region, based on the poverty rates of employment and per capita market income and all of that. And then this grant will help reduce the prevalence of type 2 diabetes and hypertension among African Americans living in West Virginia by strengthening community clinical linkages, partnering with minority serving organizations, and identifying access to community needs, develop, implement, and expand access to health education programs. And we'll talk a little bit more about some of those self-management programs later.
Now I just have one correction. That bullet point that says identify and it's supposed to be assess community needs. But we'll talk a little bit about the deliverables and what it specifically that is.
This is for minority serving organizations in West Virginia.
Okay, and then I'll talk a little bit about the application process. My name is Regina Knox. I'm a rural health coordinator in the Division of Family and Community Health. And I work alongside Sheila Plagger and Stephanie Montgomery, who serves as our data analyst or research assistant for this particular project. So as a component of the application process, we have 3 components. We have a cover page, which is just one PDF that you'll fill out. On that cover page, there's some information for you to indicate how you would like to spend the $10,000, and you'll just put the funding amounts in those specific categories. There is another category. If you have something that you're not sure where to place it at, you can place it in the other category on the cover page. We are asking participants or organizations to submit a project application, which can be on a Word document. We just want to learn a little bit more about your organization, your target population, your community, your county, and if you are already offering or if you would like to offer chronic disease prevention programs that will be applicable to this particular project. So this project really focuses on diabetes prevention, self-management, and cardiovascular health. As far as a program for cardiovascular health, the primary program that we have been promoting is self-measured blood pressure monitoring. However, you have the ability to offer other cardiovascular health programs. You would just specify what that particular program is in your project application. We also want to know a little bit about the participants that you intend to reach, like the number of people you intend to reach. And then we would like for you to explain how you plan to measure the success of your program. This is something that we can help with after you are awarded, if you're selected. Sometimes that could be a little complicated, but we try to make it as simple as possible. But in order to meet our reporting requirements to our funder, we do collect information in a report form, but want to know, how do you intend to measure the success of your program?
Yes. Just to clarify, this is for new organizations, for those organizations that we have not funded before.
Absolutely. This is actually the second cohort for this particular project. Last year, we were very fortunate to be able to get funding to do a pilot program with 6 organizations that serve minority serving organizations in West Virginia. And those 6 organizations cover Cabell, Greenbrier, and Kanawha. Am I saying that right?
Yes.
Kanawha County.
No.
Kanawha. So those are the 3 counties that we're currently implementing the same project in. What we want to do is expand our coverage area in West Virginia. West Virginia, the minority population, or African American population, is about 3%. And there's not really a lot of current data on minority health in general in West Virginia. So we partner with the West Virginia Health Equity Action Team to help spearhead this program, to help collect data, help give that data back to the community so they can share with their organizations who are implementing programs, activities, people who are doing community development, just so they can know what the data says and hopefully develop programs that community members want and will access, and hopefully help reduce the prevalence of type 2 diabetes and reduce cardiovascular disease in this particular population. So that's just a little background. So we have high hopes. The data that we got from the first cohort, even though it was a relatively small sample size, we're really seeing some interesting results that we will provide back to the communities in the form of information briefs. And we will also host presentations for the organizations in the community so they can ask questions about the data, things that they can do to implement, programs that they can implement to address some of the concerns that came up from the needs assessments. And we also plan to do focus groups. So when I get to the deliverables, you'll see those 2 specific things: community needs assessment and focus groups. And this is not a research project, this is an implementation project program. However, we are seeking IRB exemption because we're working with community members, underserved community members. Did I cover everything on here? Oh, and how do you plan on sustaining the program after funding? It's not a lot of funding. We do recognize that. It's $10,000. However, we hope that this program will be able to increase access to information that communities may not have access to already, or they don't have access to already, help them identify programs and activities that they can implement, and hopefully continue on after the funding has ended. Because we don't want to create programs that are really great, but then they go away when the funding goes away. So we would ask organizations to really think about how they can be strategic with that small amount of money and make sustainable programs that have a larger impact on the communities that they serve. And I'm just going to pause here and see if there's any questions. And you can unmute yourself, or you can type your question in the chat box. Okay, so no questions so far. Okay, so the cover sheet is what you will send in with your project application, which would be a Word document. And you're going to submit the cover sheet and the Word document. And I also forgot one element, your W-9, all together to Sheila Plogger. And her email address is noted on the FOA. And this is just an example of what we're asking for on the cover sheet. Basic information, you want to know your organization, a contact person that will be responsible for this particular program, their email address and a phone number. We really want to know if you already have an established referral policy, specifically for chronic disease prevention or self-management programs. If you don't worry about that, because one of the technical assistance options or strategies that we will provide to you is to work with WV Health Connection. They're a division in WVU School of Public Health that will help you with developing a referral system if you don't already have one. And they use a software called Workshop Wizard, which is EHR compatible. Our goal is to have bi-directional referrals. So you have 12 months to think about what that referral process would look like if you are a healthcare system and if you are a community-based organization that is not typically used to providing referrals to healthcare systems. But we really want to tie in that community clinical linkages because we're talking about preventing chronic diseases. So it's really important that community-based organizations work with their local healthcare systems, and local healthcare systems are working with those community-based organizations who are the boots on the ground, who are interacting with community members, every day in a different capacity. But we know that social determinants of health impact health outcomes, especially for minority communities. So this is just an example of what the one-page cover sheet looks like. I would like to specify that in the other category, we did already include the $75 for the focus group. So as an incentive to participate, we're asking each organization to co-facilitate a focus group, and we will provide all of the focus group facilitator training. So each participant in the focus group will receive a $75 gift card. So that would be one of the budget items. That would be $450. That would be 75 times 6 participants. Any questions about that?
Regina, there's a question in the, I'm sorry, did somebody?
Yes. Yes. So Dr. Andrews or Lori asked if there will be technical assistance offered to grantees. Absolutely. But because we're on a very short timeline, the deadline for this is on Monday, you can just email Sheila if you have a question or you want to schedule a time for us to talk about the FOA, what you should include in it, budget items. Absolutely. You just email Sheila, and I'll put her email address in the chat box, and we can get something scheduled.
And there'll be technical assistance for the new grantees throughout the grant year. So, we don't just hand the funding over to you and leave you on your own. So there'll be lots of opportunities for you to communicate with us, whether it be through email or phone calls. We also will have a kickoff meeting, and so we can kind of talk about things or any type of issues that you might think will come up. So we won't leave you hanging. I think the technical assistance part is probably one of the best things that we offer because we do a lot of hand holding if need be. So we won't leave you stranded. Stephanie, did you have you got your hand up?
Also, part of participating in this project is to complete a quarterly report. And in that report, we'll ask you about things that are going well and things that you may be needing some of that hand-holding technical assistance. So we look at that, and we'll get with, that's your opportunity to, you know, contact us with things that are not as urgent. But of course, you can always contact us prior to that as well.
Absolutely. Great point, Stephanie. And thank you, Sheila. As far as the budget goes, there are some items that are not allowed. For example, let's talk about what is allowed. So you can use funding towards personnel, no more than 10%. However, we do recognize that it takes people to do this type of work, especially if it's a new program. It may take more, you know, personal effort in the beginning. If you find that you would need more than 10%, just reach out to Sheila and we can schedule a time to talk about what that would look like. We know that travel has opened up a lot, then it's been restricted again, but you can't include travel, especially if it pertains specifically to your program. For example, to travel to go host a program in, you know, a particular community, or travel for your participants to get to, you know, your activities, travel vouchers, program materials and supplies. For example, if you're implementing a self-measured blood pressure program, you probably want to have some blood pressure cuffs. So that would be an allowable expense if you want to order incentives, but I wouldn't use the word incentives because that can be a little, there's some discrepancy about what the Bureau will allow and then what we can actually fund from a Marshall University perspective and from the Bureau of Public Health perspective. So
and a lot of that, when we say incentives, you know, program supplies, some of that can kind of go under, because that helps support what you're doing, help support that program. So,
absolutely, like printing costs. If you want to have a marketing program and you need to pay, you know, somebody to print, you know, marketing items or program materials or program booklets, for example, for the National Diabetes Prevention Program, it's a 12-month program and participants receive a curriculum. So, you know, the 12 months is really like a binder. So that can be a lot of paper if you're talking about 10 participants. So that's just an example. And any other reasonable costs associated with program implementation, you'll just put that in the other category. Funding may not be used towards research, direct patient care. For example, if you're a healthcare system, this wouldn't actually cover like the cost to do A1C tests on your participants. So that would be direct clinical care. So this is primarily health education, health prevention type of work, but it can complement your clinical work that you're already doing, specifically with participants that are high risk or have, you know, elevated A1Cs and they're considered to have prediabetes. This could complement those particular programs that you're already doing. No furniture or equipment, no reimbursement of pre-award costs, and this is going to be a really quick turnaround. And then publicity, propaganda, salaries or expenses related to influencing legislation, and that's just the CDC standard requirement. As far as deliverables, so these are the things that we're going to ask you to complete by the end of the program, which will be June 29th, 2023. However, I will say, based on our experience with the first cohort, COVID really impacted their ability to interact with community members as far as disseminating the community needs assessment. And we were not able to hold the focus groups yet. So we're just gonna get through what we can get through and accomplish what we can accomplish while keeping the communities that we're serving safe. So if we have to transition to virtual or a hybrid, or if it's safe to do in person, that's preferred, but we're absolutely flexible. So you're asking organizations to designate one person to serve as a contact person. We're asking organizations to have a minimum of 2 staff complete at least 1 hour of distance learning modules. So going back to Sheila said about the technical assistance options. So we do host monthly program meetings. They're an hour, and that will give you an opportunity to not only share what your organization is doing, but also hear from similar organizations in other parts of the state. So it's really like a peer learning type of atmosphere. It's people are totally candid, which we love. We normally use all the time. And it's just really an opportunity to share what you're doing and hear what other people are doing and maybe collaborate. So we really encourage collaboration of organizations across counties, because we're really pretty similar when you think about the communities that we serve. The distance learning modules will be available on WVU Health Connection. They have a learning software system that we are transitioning solely to in the future. But right now, all of our trainings or distance learning options are available on our YouTube page. So it's free and open to the public. The link to our YouTube page was in the email, but you can also just do a search on YouTube and you can find our YouTube page. And you can also see other capacity building workshops we've offered in the past. We do a monthly virtual office hour. We have different topics on oral. We have one on oral health. We have one on mental health. And then occasionally we do have organizations that are receiving funding serve as guest speakers. Sheila, did you have something you wanted to add?
Well, I mean, we've had things like pandemic fatigue. We have had the American Heart Association join us and talk about heart health in Appalachia, how it relates in rural communities. So there's a lot of available and very useful information on the YouTube page. I think it's a good opportunity for rural counties, because it's very applicable to what we're all in this thing together, and we all live in rural Appalachia. So you know, it's not like a speaker from, you know, way out west that knows nothing about West Virginia. So it's a great resource, really. I think free resource. So yeah, and our monthly office hours, in fact, this coming month, June, will be about implementing the Walk with Ease program in your community. And so we'll have 3 very local guest speakers that will have their perspective on the program and how to get it up and running. So that's just kind of an example of some of the topics that we have.
Absolutely. Thank you, Sheila. And so another component that will actually to complete would be the focus groups and the community assessment. We've already developed the community assessment. However, there are a couple of tweaks that we need to make to it. And of course, we like to work in partnership with the organizations to make sure that the questions on that community assessment actually get you the information that you need. So focus groups are on there. Just to reiterate that we anticipate incentives to be about $75 per person for a group of 6 people. We actually implement 1 virtual town hall or in person if possible. And the town halls we envision to be a safe space where you can share the information from the community assessment and the focus groups in a really usable format. So there'll be the information, the community profiles, and then just to have an honest conversation. This is what the data says, you know, from the community, and how can we work together to address some of those solutions, knowing that some of them we may not be able to address immediately, but as far as increasing access to health education programs, I think that's one thing that that we should be able to tackle as a community. And maybe not with the small amount of funding, but bringing everybody to the table just to let them know, these are some of the concerns and what are the solutions that we can address together as a community to, solutions that we can come up with as a community to address some of the concerns. And then we would like you to implement at least one chronic disease prevention program, keeping in mind that you want it to be something that's sustainable long-term. And there's lots of options, at least 20 different options. We just ask that it be evidence-based. And if you don't know what that is, you can that can be one of our TA sessions, but we do have some examples of programs that would fit into that diabetes prevention or self-management or cardiovascular health category. So it's just what your organization feels comfortable with, if you have the capacity to be able to sustain it long-term. Sheila, you had a question?
Yeah, well, I had a comment actually, because you referred to as evidence-based, and for some folks, they think evidence-based is all the science and things behind it, like the self-management programs, like the chronic disease self-management program and the National Diabetes Prevention Program. But there are also those programs out there that are best practice programs, things like gentle yoga, different physical activity programs, such as Zumba and things like that. So this is not always limited to the official evidence-based programs as some are used to. But there are those best practice programs out there that we know that work, that make a difference in blood pressure control and managing your diabetes. So I just wanted to throw that out there. And then Regina, real quickly, I don't know if you wanted to mention the Minority Health Advisory Group, because that's, they're part of our technical assistance and all of that too. So.
Absolutely, and thank you for bringing it up, because I forgot to include that in PowerPoint. But this particular program does have a advisory committee made up of prominent content experts on minority health from West Virginia. So we lean on them to provide their expertise. They help us. They help review the focus group facilitator guide. They help review the community assessment. They pose some questions that may be a little edgy or innovative, but they help us think through the proper way to implement this program so it can have, a bigger impact. So we are very appreciative to our advisory committee members. And then last but not least, the last 3 items for deliverables is to establish a referral system if you don't already have one, or expand referrals in partnership with WV Health Connection. Participate in quarterly, well, for this particular program, these meetings are monthly until we accomplish a significant amount of the deliverables. And then quarterly progress reports, which Stephanie talked about, and that will be through a link that will be mailed out to you from Stephanie. And we also provide you with the summary of the information that you submit to us. We provide that back to you. You can use that for, other funding opportunities for your program evaluation purposes, but we do provide that as a benefit. Any questions about the deliverables? And I know it seems like a lot for $10,000, but I promise you, if you're already in this space of providing chronic disease programs, then it's probably things you're already implementing. So we don't want it to be labor intensive or difficult. Our goal is to complement what you're already doing or support new programs that you would like to do in the future. So we're always open, for discussion, and we are flexible. So the FOA timeline is really short because our funding came it was kind of like wait, hurry up and wait, and then like hurry up and get it out. So the application due date is on Monday. It's really going to be a really quick turnaround for notifications. That will be between the 7th and the 8th. The project really starts on the day that your service agreement is executed. So we're anticipating that to be anywhere between July 1st or before through June 29th, 2023. So this is a 12-month project. Any questions about anything that we covered very quickly? And you can unmute yourself if you have a question. You can chat. You can type your question in the chat box. I also put the PDF of the FOA in the chat box. I'm going to go back to Sheila's email address here. Any questions, concerns? You think your organization would be a good fit for this particular program? And silence means agreement. Y'all gotta talk back to me. I mean, emoji, thumbs up, something.
I think it's basically a relatively simple application process. Yeah, it's not really complicated. It's not that long. So I think it's a good project.
And Stephanie, you had a question?
I did. I was just wondering, with everyone that's on here today to learn about this program, if they already have something going similar to this, or if they're starting from scratch. Rachel and Rebecca, you already have something going. Jerica, yeah.
I'm so sorry.
That's okay.
We've kind of combined, I know the self-monitoring blood pressure we combined with our pharmacy program as part of that, as an extension.
Yeah.
So kind of, I wanted to give them another number to focus on instead of weight. So let's drop some blood pressure numbers. And then I know a lot with the minority health and the focus groups, we kind of use participants and programs throughout our organization. And so I found that we're hoping to get some with the focus groups and bring them in. And if they want to go into other programs, then also kind of bring in that as well. But more than anything, I will say the data collected from the minority health research has been just completely valuable on so much things.
Oh, that's nice to hear.
Yeah. Yeah. Because it narrows down to your area specific is what I've seen, especially for Cabell County, and it's updated data.
Good.
Absolutely. And one thing I'd like to co-sign with you on, Rachel, is that I found the data interesting because we collected information from different minority communities. So there's, a significant amount of Latinos in West Virginia and Native Americans that I wasn't really aware of. And from the data, we were able to see particular health promotion activities they would be interested in based on their race and ethnicity. So I thought that was really interesting.
Well, they're underrepresented. Had you not had that survey, how would that survey is probably like the only thing that's represented them in the last couple of years, at least.
Absolutely. And then you get target specific populations based on what they said that they wanted to participate in.
And you see failing them, I think, is another part that I've to tailor our services, especially as a nonprofit, to help bring the healthcare they need. And that
I
data.
have a question.
Yes, ma'am.
Okay, so my question is, I don't know if I heard this right because I'm trying to do 5 things. So what time, does it have to be a new applicant? Because since we already have a grant with you all and because I heard that the community assessment and all that, so it's kind of similar to what we've done with your other grant. So does it have to be new?
Yes, for this particular funding, it's an expansion of the first cohort, which Ebenezer was in that first cohort. So this is just an expansion of that program. So we're looking
Okay.
for, to expand our outreach, expand more access to minority communities in West Virginia. But I do have an opportunity that you can apply for through the West Virginia Health Equity Action Team. They have a funding announcement for the same amount, $10,000. And
Right, is that the one that's due June the 13th?
yes.
Okay. Okay, so I'm just curious.
Yep, it's really the same exact program. It's just the second cohort for this particular.
Right, and that's what it sounded like. So I thought, well, okay, so why we haven't finished this one? We have to do those focus groups, so that would be kind of basically the same thing. So.
Absolutely. And like I said before, we are flexible because the first cohort of 6 organizations, we were really developing the infrastructure. So anytime you start something new, typically it takes longer than you anticipated. So we really appreciate your patience as we were working through, the incentives for the focus group participants, developing the focus group facilitator guide. So it was all new. So hopefully for the second cohort, it'll be a smoother and quicker process since we're doing the implementation development with the first cohort. But great questions, great. And I'm glad you're on to participate today, just so Ms. Wesley can hear from a current awardee.
Yes. So Miss Wesley is the new person, right? New participant.
Yes, and Jerica, which organization are you representing? If you're talking, you're on mute, so we can't hear you.
Sorry about that. I'm a faculty member in the counseling department at Marshall.
Okay, great. Do you work with the Minority Health Institute?
Yes, ma'am, I do.
Okay, great, because I did send that out to the advisors on the Minority Health Institute, for the Minority Health Institute. So thank you. I'm glad you're able to participate today.
Thank you for the invitation. Looking forward to staying connected with you all.
Great, thank you. And if we don't have any other questions, we'll just, pause right here. If you have any other questions, please share this information with, other organizations, other healthcare systems, that serve minority communities in West Virginia, because we realize that it's a short turnaround. It's due Monday. Organizations that may not typically apply for this type of funding, including if they don't have their own nonprofit status, we do accept organizations who have a fiscal agent. So if you have a coalition, a group of members in the community who want to take on this program, and they have another organization that's willing to serve as their fiscal agent, it's totally possible. So we work a lot with coalitions who don't have a, developed structure. So we're once again, we're very open to working with, coalitions, community members who are interested in doing this type of work. Sheila, Stephanie, anything that you would like to add?
Nope. Look forward to working continuing working with some and working with some new ones.
Thank you.
But also, if anyone needs to know about data collection or what we'll be asking as they're contemplating completing an application, we'd be happy to share an example with you.
Absolutely. And we did transition with the first cohort. We used to do monthly reports, but we have multiple funding opportunities right now. So we thought it would be better just to transition to quarterly, just to minimize the amount of time. Excuse me. I think it takes less than 10 minutes to complete that, the quarterly report, as long as you have all your data readily available. And we can send out a PDF, like a paper version, to help you prepare for the report. And it's done via SurveyMonkey, the data entry portion of that.
Mhm.
And we always look for success stories too, that we, from your quarterly report. But if you can get a success story monthly, we'll take it. We just like to report that back to the Bureau, you know, the successes that you guys have had once you start implementing your programs and things like that. So, but we walk you through everything. So, like I said earlier, we do hand holding, and we friend you, and we never intend to unfriend you ever. So, from this first. But that's all I have, Regina.
Okay. So thank you, Sheila and Stephanie. Thank you, Rachel and Rebecca, for being available to participate from Ebenezer Medical Outreach. In Huntington, I see Norm from Positive People Association. Thank you for joining. And Jerica, so happy to have you on today's information session. And I'm gonna get this posted on our YouTube as soon as possible so we can send it out and share with folks. And hopefully, if people have any questions, they can schedule some TA time with us to go over any of their concerns about preparing an application. And we appreciate your time. We appreciate your support, and we look forward to getting some applications in. That's the most important thing. We need people to apply so that we can hurry up and get the money out. So thank you so much for joining us today.
Thank you.
Goodbye, everybody. Have a good afternoon.
Bye.
Nice job, Regina.
Thank you. Short notice.